green light?
Red.
Red. Okay, we're recording. We're recording. Good. Okay, so what we're going to be doing with patient X, John, we're going to call him John, is I'm going to give you just a quick little overview of how to do some very gentle cranial adjusting, similar to what the Share Care class was that was taught by the Upledger Institute to lay people so they can go home and do it to themselves or their loved ones if they suffer with headaches or sinuses or eye strain. So generally what we're doing is a lot of times the head gets squished in a front to back dimension, so we're going to unsquish the head by using the blue bone and going forward with it. So the blue bone and also the yellow bone and going forward with it. And those contacts basically look like this, where you come around the forehead, you hook into this little ridge of bone, and you're gently pushing that way. And that's going to help loosen up some of the intracranial membranes and let the head float up a little bit. Great with headaches and migraines and eye strain. Also with sinuses. Next, if you feel the side of the head, there's a depression, and a lot of times it's that low spot right there, and you'll notice I'm on the yellow bone. And we're going to be going forward with our push. If you were doing it at home, it would be a pull. And we're just gently floating that yellow bone that way. More on that in a minute. A lot of times the head gets squished this way, so we're going to use the ears on the pink bones, and we're going to gently be pulling outward, and that helps open up or decompress or unjam the inside of the head in this dimension. It's also very important because if you look at the base of the skull, when these bones all come together, it affects the very bottom where all the blood vessels are coming up into the head, and also your spinal cord and cerebrospinal fluid flowing in and out of the head. So in this right here at the back of the head with the ears and the occiput, these are a lot of your muscles right here that connect to your neck. So there's your suboccipital neck tension, crazy vice grip headaches at the base of my skull. And just getting in here and doing that ear pull a lot of times is very helpful for opening that up. The other thing is, sometimes our head gets squished this way, and I literally had a patient an hour ago who went into a van and stood up, and bang, the roof of the van hit him on the head. So he is definitely jammed down. So here all we do is we just grab the sides of the head and we gently traction up this way to help unjam the head. Some of the stuff I was talking about a minute ago, especially that yellow bone. The yellow bone is very important in cranial adjusting because when this bone gets jammed, it articulates with all the other bones in the head. It's also the back, it's also the side wall and the back of the eye socket, the floor, the side, and the roof of the back of the eye socket. So here's your eye strain, migraine patients, things like that. So again, when we're on this blue bone, you can see we are definitely bringing it forward. When we're on the yellow bone, we're definitely increasing our intracranial distance. When you're doing the ear pull, you're definitely opening up the head this way. And what you couldn't see, but a minute ago when we were on the green bone and we're lifting it up that way, we're helping this dimension. There is a membrane that runs right through the middle of the head. It's the false cerebri, and it comes right up like a sail and comes right up and articulates with everything in here. So when this membrane gets tight, it really starts squeezing the whole brain. So part of what we're doing is we're creating more room for the brain, better cerebrospinal fluid flow throughout the 4 ventricles of the brain, etc., etc. When you're helping with better cerebrospinal fluid flow, the cerebrospinal is important because it's providing nutrition to the brain, but also removal of waste products of brain metabolism. So you can have either not enough oxygen and food getting to the brain and helping it work, or you don't have enough garbage being taken away, and now you have a garbage pile in the middle of your head, and it doesn't feel good. There's also a membrane that runs across the bottom here, like a sail. So when that gets tight, that's pulling your head in this way. That's where we're using the ear pulls to pull outward on the head. What I just said, I'm going to give a very quick demo of the hand positions, and I've got the piece of paper here, just because we have to. It's the internet and security, patient security. Okay, so anyway, there's the forehead, there's the blue bone, and I'm just made contact with that little ridge of bone, and I'm gently floating the bone upward toward the ceiling. If he was sitting, it'd be forward. And all this is very gentle, light touch technique, maybe the weight of a nickel, maybe 2 nickels. It's very light. The more light, the better. You're really working with the skull and the membranes, and you don't need a lot of force. It's very gentle. So that would be the blue bone or the frontal bone contact. On the side of the head was the yellow bone, and there it is right there. My fingers are right on it, and I'm gently making contact with the yellow bone, and I'm lifting it forward. Okay, gently. The green bone or the parietals we were talking about earlier, where we want to increase the distance of the head in this vertical dimension. I'm just on the side of the head, and I'm just gently tractioning upward toward the sky. Now, upward in this case is toward me because he's laying down. And that's that. The ear pull that we talked about, you can either just grab the ear lobes, okay, or you can grab onto the cartilage a little bit, and it's just a very gentle traction outward. It's mostly an outward traction with a slight 10 to 15 degree down angle. But that's the general contact. Now that I said that, sometimes you just want to feel which way is it restricted. So if I'm pulling downward or forward or even upward, sometimes you'll feel there's a restriction in one of those, and that's where you want to just stay with your gentle contact and just help things loosen up. A lot of times you want to ask your patient, how you feeling? And usually 3 things are happening. They're like, oh, that feels so good. I can feel the pressure releasing. It just, it's the pain's going away. That's a good thing to do. So you might want to stay there for a little while longer, maybe 10, 20, 30 seconds, about 30 seconds longer, and just keep checking in with your patient. How you doing? How you doing? Oh, it feels great. It feels great. Good. Stay there. You might end up being there for 5 minutes because you might be releasing a very old trauma that's in the body. Other times you're doing something and you go, how you feeling? And they go, I don't feel much. Okay. So just stay there for maybe 30 seconds or a minute tops, and then move on to another area. So that area may not be a primary site, unlike the first example we just gave. The third example is you're on something and you see them contorting their face and they're wincing and they don't feel good, or they might tell you, how's that feel? Oh, I don't like that. That hurts. Okay, stop. Go work on another area. Just leave that area alone. Maybe it's the wrong sequence. Maybe you have to go work on other areas first. Okay. The other thing I didn't talk about was sometimes sometimes the head is jammed again in this dimension, and you can't get everything from lifting this way, so you have to be down on the jaw, tractioning down. So here you go. We're just on just below the TMJ, around the ramus of the jaw, and it's just a nice gentle traction downward. A lot of times it helps if the patient's mouth is open, because you can get a better downward traction than if they're closed versus open. And that's it. You just stay with it, and you're looking for that jaw to just kind of drift down, and it might wiggle and waggle and float back and forth, and you just stay with it. Just stay with it. And just keep riding it down. Another thing you could do is there is, again, that suture that runs right through the middle of the head. It's the sagittal suture, and it's a membrane deep inside the head, the falx cerebri, which we talked about, that when it tightens up, it can push your head this way. It can also push your head downward as it tightens up. So a lot of times, just doing a direction of energy technique, or a V-spread as they call it, or therapeutic touch, these are all different names for this style of work, where you're just making contact with the area, and my middle finger, and really I could just go like this and be on the specific spots of that midline and help it relax, but why not just go for a more general approach, because it really will feel good for your patient, and make contact with that membrane on the sutures externally, and just help that whole membrane just relax and loosen up, and that the whole cranial vault, the brain that's surrounded by the dura mater, just help all that dura mater just relax by sending some healing, compassionate, loving touch into the area. This is something that I was just showing somebody an hour ago. He can definitely go home and put his hand on his head. And even if he doesn't remember all these things I showed him, he definitely can put his hand on his head and just help the membranes relax inside the head. Dr. John Upledger coined an expression, the inner physician. A lot of times when you put your hand on an area of the body looks at that and goes, why is that hand there? And it starts reviewing and assessing that area and going, oh, look, there's some tension in that area. We need to relax that. We need to let the body relax. We meant to do that 2 weeks ago, but then we got busy and we forgot. But now, thank you for bringing it to our attention. We will help this area relax. So a lot of times, just putting your hand, the person putting a hand on themselves, or even a loved one, just putting a hand on an injured area will help create some soothing, some relaxation of pain, some relaxation and some decrease of pain. It's why it's called loving, compassionate therapeutic touch. And I think that's it for now. If you want to hit the stop button.